Since you learned that you are living with multiple myeloma, you have probably talked to your healthcare team about which treatment options are best suited for you and your current situation. There is no one-size-fits-all treatment approach for multiple myeloma, and the overall goal of treatment is to manage symptoms, slow its progression, and ultimately work towards controlling the disease and possibly full remission. Disease control or partial remission means that the disease is stable and not progressing, while full remission means that there are no detectable myeloma cells left in the bone marrow. Today, there are several effective treatment options available for people living with myeloma that are selected based on their specific needs, symptoms, and preferences. Let's consider the main types of treatments for myeloma. The most commonly used treatments are chemotherapy, proteasome inhibitors, immunomodulatory agents, monoclonal antibodies, corticosteroids, radiation therapy. For the best possible outcome, these treatments are often used together in combination. This is the standard of care in multiple myeloma and common for all stages of myeloma. Standard of care is the current available treatment used for a certain type and stage of disease. Chemotherapy involves the use of medications to stop the growth of cancer cells, either by destroying them or by stopping them from dividing and multiplying. Although chemotherapy is used to attack myeloma cells, it also damages healthy cells. In other words, it is not a targeted therapy that only impacts the myeloma cells. The chemotherapy drugs most often used for the treatment of myeloma in Canada are cyclophosphamide and melphalan. These chemotherapy drugs are also used as part of the stem cell transplantation process. This treatment is discussed in detail in the stem cell transplant video module. 3 other categories of medications are collectively known as targeted therapies. Unlike chemotherapy drugs, targeted therapies act primarily on myeloma cells and therefore have less effect on healthy blood cells. Proteasome inhibitors work inside myeloma cells by blocking the activity of a pathway in myeloma cells that breaks down protein. This pathway is often referred to as the cell's garbage disposal. Blocking this pathway causes a buildup of unwanted proteins in the cancer cell, causing it to die. Bortezomib, given subcutaneously, an injection into the skin, was the first type of proteasome inhibitor approved for use in Canada and is most often used first line in combination with other medications, as well as when a person experiences a relapse. In recent years, new proteasome inhibitors such as carfilzomib, administered by infusion, and ixazomib, taken in pill form, have been approved by Health Canada. Immunomodulatory agents, known as IMiDs, can destroy myeloma cells, boost the immune system to slow the growth and progression of myeloma cells. IMiDs also work inside myeloma cells to interrupt processes and destroy them. With the availability of newer IMiDs, such as lenalidomide and pomalidomide, the use of thalidomide, an older immunomodulatory agent, has decreased. All 3 drugs are typically used in combination with low doses of an oral corticosteroid called dexamethasone, or less commonly, prednisone. Monoclonal antibodies, also known as immunotherapy, given by infusion, is the newest class of drugs approved for the treatment of myeloma. Monoclonal antibodies destroy myeloma cells in 2 ways. 1. Directly by attaching to specific proteins on the surface of myeloma cells, leading to their destruction. And 2. Indirectly by flagging myeloma cells so that your immune system can identify and destroy the cancerous cells. The most commonly used monoclonal antibody approved for the treatment of myeloma in Canada is daratumumab. Like IMiDs and proteasome inhibitors, monoclonal antibodies are typically used in combination with other medications. Corticosteroids, also known as steroids, are chemicals naturally produced by the human body to help prevent inflammation. Synthetic or man-made, steroids can be used alone or in combination with other drugs to treat myeloma. Corticosteroids are used as the backbone in almost all treatment regimens. The corticosteroids most commonly used in myeloma treatment are prednisone and dexamethasone. Radiation therapy is typically used on specific parts of the body to treat bone pain caused by myeloma, or a kind of bone or soft tissue tumor called a plasmacytoma. It is usually used in combination with some form of chemotherapy. Radiation therapy works by using high-energy radiation to damage myeloma cells and prevent them from growing. In addition to these treatments, other promising therapies are continuously being tested in clinical trials. The treatment options you will be offered are tailored to your needs based on several factors, including your age, your general health, the stage of your myeloma, your blood counts, the types of symptoms you are experiencing, your own personal preferences and goals for your treatment, as well as the accessibility and availability of the treatment in your province. It is normal to feel stressed or anxious about starting a new treatment regimen, but a good understanding of the available treatments will help you prepare and plan for your future treatment options. Ask your healthcare team to clarify any questions you may have and what to expect based on their experiences with helping others. You might also find it helpful to talk to other people living with myeloma, perhaps in a support group, to learn more about their experiences with treatment. There are several different ways that people can get access to the medications they need. A government health insurance plan, if the treatment is publicly covered. A private insurance plan that will pay for some or all of the treatments. A clinical trial that pays for some or all of the drugs being tested. Payment assistance, also known as compassionate access, sometimes offered by the drug manufacturer, or pay for it yourself. No matter what treatments you and your doctor decide on together, you may still have concerns. Discuss with your family, friends, and others living with myeloma. Reach out to your healthcare team or a local or online support group to help you better understand your options. They can also help you cope and provide advice on how to maintain your physical and emotional well-being. For more information on available treatment options and educational resources, visit www.myeloma.ca and download or order the Multiple Myeloma Patient Handbook.